Hello and welcome to WVU Medicine Tuesday Talks. I'm your host, Mary Ravazio Menard. We are just 9 days away from moving the first patients into the new WVU Medicine Children's Hospital, which includes a blood disorders and cancer center. This is where our expert pediatric hematology and oncology team helps kids beat cancer with the latest tools, therapies, and technology. Today, we're talking with Dr. Patrick Tomboc, Chief of the WVU Medicine Children's Division of Pediatric Hematology and Oncology, about the fantastic new Blood Disorders and Cancer Center. Welcome, Dr. Tomboc, to Tuesday Talks.
Thank you for the opportunity. I really appreciate it.
Well, it's great to have you here. So, first off, I didn't realize this till you just told me it's Pediatric Cancer Awareness Month here in September.
Yes. It's a wonderful time of the year. This is where we try and highlight all of the things that we do for our kids and really do our best to make everyone aware of pediatric cancer and how much it affects everyone in your life whenever it happens. It's very much a ripple effect within a family, within a community, and you very much see it. One kid gets sick, everybody knows about it, everybody helps, and everybody steps forward, and that's like the beautiful thing about my job, just seeing the people come out of the woodwork to help these kids who they generally don't have any interaction with or any even relation to. People just come out of the woodwork to help these children, and especially during this month we really see it with people donating more events for our kids, and then our staff really take the lead at making sure everyone who's in the hospital and everyone who comes in the clinic knows that we are raising awareness for them, for their families. And we just want everyone to know how much we all appreciate their trust in us. Especially that's the thing that gets me, the families' trust in our ability to take care of their kids, the trust that they put in us to take care of something that is so very important to them. Mm-hmm. We just want to show how much we appreciate that and how much we are working towards their cure and their family's health.
Wow. You really have to have a passion for this line of work, don't you? Mm-hmm.
It is very much self-fulfilling, though. There is, whenever anyone finds out what I do, there's always this audible sigh or sad eyes about, mm-hmm. Oh, that's horrible. I don't know how you do that. I don't know how you are able to work in that field. But I really do feel very lucky. These families put an unbelievable amount of trust into our ability to take care of a very, very serious disease. And that is just amazing. But also, I work with kids all day, and it is by far the thing that just drives me and moves me. These little kids, we throw horrible things at them, poisons and radiation and surgery, and they are playing, dancing, bouncing, doing everything through it and not really missing a beat. And thankfully we have lots of medicines that help treat their symptoms and allow them to be able to play and be kids again. But it's just a beautiful thing to see, when a kid go through something so terrible and then come out the other side and really thrive. Those things just drive me and really just give you a ton of energy and able to be able to overcome all the weird things and all the bad things that end up happening during regular treatment.
Yeah, sure. Now we're getting ready to open up the new Children's Hospital, and there's 5 centers of excellence, mm-hmm. and the Blood Disorders and Cancer Center is one of them. So let's talk a little bit about that. Mm-hmm. Tell me, what is the mission of the Blood Disorders and Cancer Center?
The mission is to absolutely elevate the care for pediatric cancer patients and their families in the state of West Virginia and in the surrounding areas. For years we have been we've been involved with the Children's Oncology group, providing absolute state-of-the-art care. This new facility will not only bring more technology and more advanced therapies to West Virginia, but it also allows us to bring in more pharmaceutical trials, bring newer therapies that are not in a lot of places to this institution, which is going to dramatically increase the opportunities of therapy that mm-hmm. our kids are going to have. And so this new the Center of Excellence is just going to allow us to dramatically build our program and allow us to expand in such a way that we can entice more and more companies to do research, allowing us to give better treatments, more advanced treatments, and newer treatments.
So what features are there in the new hospital that will, improve your already high quality of patient care?
I think the most, oh man, there are so
There's so many.
Yeah, there's so many things that I get really excited about. I think that we're going to have a dedicated procedure room where we'll be able to do the bulk of our procedures. The majority of the procedures I do are things called bone marrow biopsies, where we're looking for and checking for leukemia or other kind of metastatic disease in bone marrow. And also, we very frequently do lumbar punctures, where we sample the spinal fluid and also put in chemotherapy to prevent dissemination of disease into the spinal canal and into the brain. We do these procedures very frequently. I did 2 today. And really, to have a dedicated space where we're going to be doing that is going to be huge, not only for the providers and the nurses who take care of these patients, but really for the patients to have a consistent place where they are always going to get the same procedure, that level of normalcy, the level of trust. All of that's increased now. All of that really decreases their level of stress, which is just hugely important.
Yeah, they need a routine, don't they?
Absolutely, absolutely. I think the other piece that I think is going to increase how we deliver care, but also increase the quality of life of our patients, is our new Infusion Center. Currently, our Infusion Center is a 5-bay area where all of our kids get their infusions, and we're kind of limited to 5 people at once getting chemotherapy, blood products, medicines, anything like that, or checking labs. When we move to our new area, we're going to have 10 Infusion Center rooms where we'll be able to deliver obviously more care, because we're dramatically increasing the number of rooms that we have available for infusions, but also we've been given space to have a communal area for the kids, so a place where the kids can play and meet, a place where the families and the mothers and fathers can interact and really commune, share their stories, share their experiences, and find some commonality in the kind of really horrible thing that they're all going through, and hopefully generate some friendships and some relationships that help carry them through that. It's been very hard in a state that is very rural, and patients are spread out so far.
Yeah.
They don't, you don't know someone who has cancer. You don't know a kid who has cancer. You might, mothers and fathers can't look to another family in that town that has had a kid with cancer, and so it can be very isolating, very very lonely. And so I'm hoping with this communal area, there'll be a way for some more organic interactions between families, between kids, where they can find some normalcy in their experience and in their shared experience. We do have a kids' cancer camp, Camp Wanaka, Camp Hemavon, where a lot of that happens. It's a phenomenal camp where you see kids, you see kids sharing or comparing port scars. There's to give chemotherapy and draw blood, we have to implant a port underneath the skin. And it gives a very, unique scar. And you're not, if you're 7 years old and you had leukemia when you were 3 and you're off therapy now, you have this scar that nobody in your school has, nobody at your church has, none of your relatives have. But you go to camp, for, a week in the summer, and more than half of the kids there have a port scar or still have a port and are going through therapy.
Yeah.
And so I think that very much normalizes at least the port experience, but they can also talk to the older kids who went through chemotherapy and what their experiences were. They can share their own experience and rationalize it, understand it. I don't know. It's just a really beautiful thing to see the awkwardness of their diagnosis shed away from them at camp. Because everybody else has had cancer, everybody else has a bleeding disorder, and they find that kind of commonality. And it's a really amazing thing to see, and it's so very important. And the camp, our camp's been great, continues to grow. And hopefully, I think next year, last year we had around 50 kids, and I hope next year we're going to have 60 or more. If we do, one day, if we do get in a position where we have funding enough, I'd love to include siblings, because I do think the siblings of our patients are, just inhabit a very unfortunate position, because they're not sick, but they lose at least one parent who has to come in with their brother or sister who has, whatever they have, and they're gone for days at a time. They're gone all day at times just to get chemotherapy. I think it is one population that we just have not had enough time or enough resources to include, but I do very much hope to include that as we grow and as we get bigger.
And I think that's one of the interesting features of the new Children's Hospital in the Family Resource Center. Siblings are included. In fact, there's even a sibling room. Can you talk a little bit about that and why that's important?
Oh, it is. Right now we have a 2-year-old little girl who was recently diagnosed with a cancer, and she has a 6-year-old sibling. And the family's been struggling with what do we one, tell the older sibling, but also what do we do? Because both parents want to be at the hospital and want to take care of their younger daughter, but they have another child. And I've talked to them about this very palpable struggle that they're dealing with. That's where I think the Family Resource Center is going to shine for a number of reasons. So, like, the Family Resource Center is a place where my parents and my patients can go to step away from their disease, to step away from their treatments, to step away and have a reprieve from the day-to-day hospital drone, the medicines and the treatments and the x-rays and everything. They can step away from that, get a breath of air, see a really gorgeous view, and have a place to really relax. The kids, like the sibling area, has video games and things that kids can play with. The kind of more adult area has just benches where you can just sit and take a breath and look outside. And that
what a view!
No, it's a beautiful view, and I mean that just to be able to step away for a moment, that can be so grounding. And also in such a beautiful area. It's just a beautiful place, and it's going to have such a huge impact on our patients who have to stay for 2, 3, 4 weeks at a time. That they have a place to go away from their room where no medicine's going to happen, where no drugs are going to be given, where there aren't any procedures, where they can just take a breath, they can play, they can be kids again, they can have fun. And it's for both the kids and the adults, and I think that's just unbelievably important.
Why is it important to have, not only a Family Resource Center, but all of these cancer and blood disorder services under one roof in a building that's just for kids, and their families?
It takes an entire village to take care of these kids with the level of specificity of chemotherapy and the level of sensitivity with all the scans and labs and everything. Having all of the pieces, having everything you can need to take care of a kid, make sure you don't need anything. Make sure that we have this kid who's maybe didn't respond to therapy and we have to do something emergently. If that was my kid, would I want them to hop on a plane and fly, or a helicopter and fly 3 hours somewhere to get this emergency care? Do I want to stick them in an ambulance where they could get in a car accident? And there are all these. You're adding so many variables into an already very scary situation. Having everything under one roof, you are prepared for any eventuality. You are prepared to take care of that kid in totality, right? You get everything covered, and that is, just for peace of mind, for my own peace of mind, but also for a family's peace of mind, that they know we can take care of their kid in case anything happens. That's huge. That's hope and that's reassurance. And it's nearly impossible to give those kind of things. But when we have an institution that is focused on kids, that is focused on their health, that is focused on improving every aspect of their health, we will be able to take care of them in every way, shape, and form. And that is,
it's a game changer.
Oh, absolutely. Like, not having to send somebody somewhere is massive. Because, for taking care of the kid, but also, think about it. So if my kids got sick, so one of my kids gets sick, I have to take them 3 hours away. If they have to go for chemotherapy one time a week for 3 hours, you are taking the day off work, you're taking the kid out of school, and you're driving 3 hours one way, sitting for 2-3 hours, and driving 3 hours back. That is the day. The entire day is gone. You can't pick up your other kids at school. You can't pick up dry cleaning. You can't go grocery shopping. You can't life, right? You can't do anything with life. And say you have to fly. So say you have to fly to, you fly to New York to get your therapy. If you had to fly to New York, you are by yourself, right? You are stuck in a hotel or in Ronald McDonald House. You're getting chemotherapy, and And if your car breaks down, who do you call? If you can't pick up someone from somewhere, you can't call your family, you can't call a coworker, you can't call your friends. You are isolated. And that is, and not that anywhere in New York or anywhere else is bad,
Anywhere.
but you don't have your support system. You don't have your people that can
Right.
help you. You don't have family that can help you. You don't have your church that can help you. You don't have backup. And so being able to provide every possible therapy, make sure that not only your kid's taken care of, but your family's taken care of.
Yeah.
You're taken care of. You have a minute to step outside and have a breath, and someone else can come watch your kid. Like those moments, I mean, can make or break a day. If you can step outside, have 5 minutes, someone you know and you trust is watching and making sure nothing weird's happening, your kid's doing okay, but you can step outside for 5 minutes, take a deep breath, recenter yourself, and then come back and be fully present and fully capable and able to help your child get through whatever they're getting through. That is, there isn't an amount of money that can cover that. You know, it's amazing. So
There are so many really cool features to this new hospital, and I know one that a lot of people are talking about, and it's just something as simple how these inpatient rooms for many of the patients you handle that are maybe, you know, they're not there for just a day,
Right,
you know,
right.
they're there, you know, for longer stays. But these rooms are designed just for kids and helps them feel in control about the smallest things.
right.
Like, talk about a little bit, you know, the twinkle
Yeah.
lights and.
Yeah, I mean, so like, especially with younger kids, not control, but there are a lot of power struggles with little kids taking medicines. They control getting medicines in their mouth. They don't want to take them, they'll spit them out, and it's a big problem with some of our medicines that are very important or very dangerous or just everything. And so compliance is always an issue. Giving kids some level of control, giving kids some level of choice generally diffuses that power struggle and allows us to do the things we want to do. So one of the really it's absolutely a beautiful feature are these lights. They're like little LEDs that are above the patient's bed that the patient can control. They can control the color, blinking, brightness, all those little things, and it's theirs alone to control. So they can have a blue room or a red room or a white room or whatever they want.
Change it every day.
Yeah, every day, every 5 minutes if they want.
Yeah.
I think it's a great feature that focuses on personalizing that room, that space for them, and it's their choice. It's what they want. The rooms, I mean, are absolutely amazing for our patients. Some of our patients have to stay in the hospital for 2, 3, 4 weeks. In that time, when you have to be able to bring clothes for the people that are there, all the things that you accumulate while you're there, there's much more storage in our rooms. There's more room for a mother and a father so that they can care for their kid while they're in the hospital. They have a refrigerator, which is just super helpful on a number of levels if you want to store food for your kid that, like, your kid only wants to eat one kind of yogurt or whatever.
Yes.
When their immune system is depleted and they've gotten a lot of chemotherapy and they only eat one kind of yogurt, now they're able to keep that yogurt in the room and just grab it whenever that kid needs it. It's a massive, massive benefit. I think one really, really important piece that's more infection and survival focused. So the Blood Disorder and Cancer Center has its own closed unit. So all of our patients will be separated from the general population of pediatric patients that can have influenza, COVID, bacterial pneumonias, other infectious diseases. We get to separate them and cohort them together in negative pressure rooms, so the air is blown out of their room so nothing comes in. It protects these kids from all of the airborne viruses that right now are and have been ravaging a lot of our kids. Right now, enterovirus, rhinovirus is knocking out kids all over West Virginia right now.
Yeah.
And in a room, like in a unit, in our unit, you can't put one of those infectious kids in that room. And with negative pressure, we make sure that none of that virus accidentally wafts in or gets blown in. And it just provides a higher level of security for them, assures that they will not get exposed, their parents won't get exposed to these viruses that can be really, really dangerous for our patients who don't have an immune system. And so I think that is probably the biggest step and biggest move towards really protecting our kids, physically protecting them, as we keep them out of the general population, we keep them away from people who have infectious diseases, especially when they're very immunocompromised or when their immune system is zero basically, and they can, anything they could catch could kill them. Keeping them separated just is probably the best thing we can do so they don't get sick again or get
Sure.
sick anymore.
Sure. Well, the new Children's Hospital has so many great features, just like what you talked about, just as that enhance care, and it also has a lot of fun things. You're not only treating the patient, you're treating the whole family and taking care of the whole family. But I have to ask you, do you have a favorite part of this new hospital that you're really looking forward to, that will make a big difference? You can have more than one if you want.
Yeah. So it's kind of a sillier thing. So whenever a kid finishes chemotherapy, whenever they've completed their end of therapy scans, they don't show any signs of cancer anymore, and they've kind of recovered from everything, we symbolically ring a bell to kind of honor the experience they've had, this long road that they've been through, and it signifies what they went through and what they dealt with and how they carried themselves through this whole horrible experience, right? And so previously we didn't have a lot of room for a bell because we had a smaller center, so we had this very, it was still a great bell, but it was a very small bell.
Yeah.
And so with the new Infusion Center, we got a significantly larger bell that's significantly louder, and I'm very excited about that bell.
I saw it yesterday.
Yeah, it's
yeah.
huge. And a beautiful
It
piece of art right next to it that sits next to it with the gold ribbon on it over the state of West Virginia. It was made by a very good friend of mine, just to signify all of the work that all these kids have gone through to get through this chemotherapy. But the thing that I'm so excited about that, but the thing I'm really, really very excited about is our gong. But in the inpatient area, there wasn't really anywhere to put a large bell. And so just after we talked for a while, we determined that we could have something that could roll out that kids could ring at the end of therapy when they finish their inpatient therapy. And we were rolling through ideas, and we landed on this gigantic gong. So we have a 30-inch gong that has this beautiful wrap on it that has the state of West Virginia and the golden ribbon on it. And it's massive. We bought it online. We realized
how much fun is that?
Yeah, so I have to build a base to the bottom of it so it'll roll, and we have a place to store it. But whenever a kid finishes, I cannot wait till the first kid comes or finishes inpatient chemotherapy and gets to whack this gong, because it is so loud, and it'll be such a great experience. But that's probably the thing I'm very excited about right now, because I'm working on putting it all together and building the final piece on the bottom. But I think that is just going to be a ton of fun for the kids. It's going to signify such an amazing journey that they've had, and it's going to be really loud and wonderful. So I'm very excited about that right now, and it's just going to be a lot of fun. The other part of it is on the back of it, we're gonna imprint the names of every kid who rings it, every kid who finishes therapy, and we'll get a new gong whenever we fill that gong up. And so that way we'll be able to hang that gong up on the wall, showing all these kids who have hit the gong, and just keep on going. We'll fill up the walls with gongs with all these kids who've survived cancer and are doing well.
So you're going to do the bell and the gong.
Yeah, so you get to ring the gong if you finish your chemotherapy inpatient. You get to ring the bell if you finish your chemotherapy outpatient.
Okay.
So
that's cool.
You can honestly let them ring either one or both of them if they want. It's going to be a lot of fun either way.
You always keep fun part of the element of all this. So I have to ask you about, speaking of fun, Tutu Tuesdays. Yeah. What are Tutu Tuesdays, and how does that help help kids?
Really, it's more for morale and honestly, it's just to make the kids laugh. Seeing me in a tutu is honestly one of the most awkward. Yeah, I am not even remotely a dancer or ballerina. I am not shaped like a ballerina. I never will be shaped like a ballerina. And so wearing a tutu is just very absurd. But on Tuesdays, every Tuesday during Pediatric Cancer Awareness Month, our entire staff puts on gold tutus or multicolored tutus to really, one, spread the word about pediatric cancer awareness throughout the hospital and throughout the community, which is really odd, going grocery shopping with a gold tutu. But
you've done that, huh?
I gotta walk the walk. So
you walk the walk.
So, but rounding in the morning, seeing patients wearing a tutu, the kids are laughing and they are smiling, and that's honestly, all of my staff, all of us, will do anything to make our kids laugh. anything to make our kids smile, because we
You have
know
to show them.
it takes, it just
Yeah.
changes the demeanor. So this one, this tutu specifically was given to me by one of my patients. I bought the gold one. She gave me this one, and this one's actually very special and honestly my fanciest of tutus, because it does.
What's underneath there?
There it is.
Mhm.
It has LED.
Oh, it has lights.
Multicolored LED lights. It is fancy.
That's awesome.
She is a very creative and wonderful patient, and a very generous family, and they've given me this wonderful tutu that has
lights.
Yeah, so
I love it.
I will be wearing it for the first time next Tuesday. I wore the gold one this last Tuesday.
Okay, so you'll wear the LED lights next week,
Yep.
huh?
Mhm.
Oh, that's great. Gongs, tutus, bells,
Yep.
you know.
Anything to make it better for the kids.
Wow, that's great. That's great. You said that I've seen on the website anyway, that you offer innovation and inspiration through a program called Connecting Champions. What is that? How does that work?
Connecting Champions is a phenomenal program that was started in Pittsburgh and was brought here. It's a really poignant thing. So whenever a child gets diagnosed with cancer, if I'm the one who's diagnosing them, I'll go in and talk to the family and the child about what's happening, what their diagnosis is, what the plan is, what we need to do moving forward, and then try and answer any questions I can. Generally, it's not a fun talk, but it's called the new diagnosis talk. It's not fun. There's generally crying, and people are very sad because it's a really sad and really scary thing for families. What Connecting Champions does is so very important, because it's after that talk, after the families have had a minute to digest, and after the kids seen their parents cry and deal with this really chaotic thing, they come in and say, what do you want to be when you grow up? And it reframes the whole situation, right? It reframes everything. It reminds the families, the parents, that their kid is still a kid, that their kid is going to get through this, that their kid is going to grow up and do something.
Yeah.
And what is it? What do they want to be? Do they want to be an astronaut? Do they want to be a chef? Do they want to play baseball or football? Whatever it is. What Connecting Champions does is it finds someone in that world who will be their companion, their friend, and
great.
builds in during COVID. Like, they started during COVID and did a phenomenal job. The hard thing was most of the interactions were all virtual, because we couldn't have visitors in the hospital, risk for COVID infection was all there. But they set up all these virtual events, all these virtual meetings where, a kid could talk to a seamstress or the clothing designer for 3 or 4 hours online and talk about how they make dresses and how they do things. One of our patients is a very gifted artist, and does a lot of pencil things, and just does a lot of really beautiful art. Just really talented. They were able to connect him with I think he's in Pittsburgh, a digital artist in Pittsburgh, and the things they've created together and the things they've created from that are just absolutely amazing.
Wow.
And so, I mean, it is one reframing that very first experience. Like, whenever anyone hears the word cancer, they immediately think that their kid's going to die. That your mind immediately goes there. Like,
It'd be
this is
hard
the end.
not to.
Right, absolutely, and that's not inappropriate at all.
Yeah.
That's human nature. Right? That's how we're built. This brings them back, right? This reminds them that child's not dead. That child is not their disease, and that their child is going to get. Yeah, it gives them hope, and it's not inappropriate hope. It just reminds them that, hey, they wanted to be a firefighter yesterday. They still want to be a firefighter.
Yeah.
Let's let them be a firefighter.
Yeah.
And I mean that is powerful. But the other part of this is all of my kids spend so much time in the hospital getting chemotherapy or recovering from infections or whatever. This provides them a way to step out of that hospital situation, step out of that hospital experience, and do something that they love, that they care about, that they find enjoyable. And it really, it's just what amazing things that kids can do. They can separate themselves from what they're experiencing now and go into this, talk about anime for 2 hours, talk about cooking, designing a menu for an hour. Like that, it's a powerful thing, and it's free.
Yeah.
And 2, it's all been virtual, so you can connect with anyone in the world, right? You can connect with a scuba diver in Mexico or a skydiver in Seattle. because it's virtual, it allows for really just any experience you want, anything you're interested in. You get a friend, and you get someone who's going to check in on you, who's going to provide distraction when you're in the hospital, and could, with some of our kids, to like find things that they really want to do as they get older. As they generate these relationships, they find like work that they want to do. It's a beautiful program.
Sounds wonderful, really does. So we're just about done here, but I have to ask you, before we go, we've covered a lot of ground, a lot of great information. What's the most important thing you want people watching to know about the new WVU Medicine Children's Blood Disorders and Cancer Center? Besides the tutus.
Yeah. I think the really important things. So I think the most important thing to know is that the new Cancer Center is gonna continue our relationship with the Children's Oncology Group and expand our relationship with the Children's Oncology Group. The Children's Oncology Group is every major pediatric cancer center in the country, and then in multiple other countries around the world. We all work together to move the ball forward in cancer research, long-term therapy, outcomes, new treatments, and new trials. And we are all working together. So the therapy, like the ALL therapy that you would get here, is the same you would get in Pittsburgh, at CHOP, up into Boston, south into Texas. We all are using the same drugs, the same medicines, the same protocols, the same dosing, because we know it works. Right. Because we have data pooling all of the kids from all of those hospitals pooled together to make the treatment stronger, more efficacious, and to better understand the side effects. It democratizes cancer therapy for kids. You don't have to live in Houston to get the best cancer therapy that the country can provide. Anywhere in the country that you live, you can get the therapy you need. With your support system around you, with your people around you, with your family around you, and that is powerful.
Makes a big difference.
It's unbelievable. It is an important and beautiful thing. You can get your therapy. You can get the best therapy possible close to home. That is, there's nothing more important in health. Yeah. And that you don't have to drive 10 hours or get on a plane to get therapy is massive. It's
excellent.
Massive.
Well, thank you so much. This is such good information. I can't wait to get over there and see that gong. I want to see the gong.
The gong's amazing.
But thank you for sharing this information, and we'll be seeing you soon over in the new building. It's just a little bit away now, so thank you so much, Dr. Tomboc.
I appreciate the opportunity.
Well, that brings us to the end of this edition of Tuesday Talks. If you're looking for more information about the WVU Medicine Children's Blood Disorders and Cancer Center, visit WVUkids.com. And join us next week on Tuesday Talks when Children's Chief Operating Officer Amy Bush will tell us how the dream of a new WVU Medicine Children's is finally a reality. I'm Mary Ravazio Menard, and on behalf of Dr. Tomboc and everyone at WVU Medicine, thanks for joining us and have a great day.